What's up, you guys? It's your girl Breathe the Diva, and I'm back with another video. So today I will be telling you things you should not do as a sterile processing technician. As a sterile processing tech, you guys, your role is very critical in maintaining the cleanliness and the sterility of medical instruments. And to ensure safety and job effectiveness, these are the things that you should not be doing as a sterile processing tech. Right, number one, you guys, and I got my notes here. So the first thing that you should not be doing, you should not be skipping or rushing cleaning steps, okay? I cannot stress this enough. We should not be skipping steps, okay? Because if the IFU says one thing, we need to follow directly by what the IFU says. And then why is it dangerous, you guys? Because when you skip the pre-cleaning, the manual scrubbing, or the ultrasonic cleaning, it leaves room for error, and it also leaves room for you to leave bioburden, which can cause infections. And everybody know you can get a staph-acquired infections from dirty instruments. A lot of people don't know, like when people come in and they get infections from the instrumentation, these infections can cause loss of limbs, death. Like, it's serious. People may think of, oh, it's just a little bioburden. Yeah, these things can really cause like real trouble for people in their lives. Like, you come in to get a surgery and you leave out with an infection and more issues than what you came in with. So please just be careful in not skipping the steps, because it's really important. You wouldn't want to come in to get a surgery and then you leave with infection and you got to have your whole leg or your whole arm cut off because somebody just rushed and skipped a step and didn't find the bioburden. And then another one, you guys, don't assume that an instrument is clean because it looks clean. So just because you don't see bioburden on the outside, bioburden can be in the inside, especially if you have like cannulated instruments. They can be on the inside. So don't just assume that the OR didn't use it because it don't have blood on it. Treat everything as if it's dirty. All right, now we're gonna go into number 3. But y'all need to stick around for the very last one, because the last one is the most important thing that you should not be doing as a sterile processing tech. But the third one I got here, you guys, is bypass sterilization protocols. So that can mean like, you know that an implant's supposed to be on a 460. You put on a 430 instead. You know, these things, like I said earlier, it can cause serious complications. It can cause death. So you just want to be careful with that, because if you're not putting the right time for it, that means that the instrumentation is not getting properly cleaned. And don't shortcut autoclave cycles, like I said, or skip biological release. So that means just like releasing instrumentation without the biological passing. You don't know if it's going to pass or fail. So just be mindful of releasing instrumentations. All right. The fourth thing, you guys, is mix up clean and dirty areas. You have a clean and you have a dirty side for a reason. So let's not like cross-contamination. So just like you bring something from the clean area and you take it back in decon and you talking to somebody back there, that item is now considered unclean. So don't store, contaminate, or anything like dirty and clean. It's unsafe. All right, you guys, number 5, don't ignore IFU. So the IFU is the instructions for use. You want to follow this to the T. This will let you know what detergent you need to use, what sterilization you need to put the instruments on, what brushes you need to use. Because sometimes when you don't follow this, it makes the sterilization ineffective. It means like pretty much everything that you did, it went out the window. So make sure that you follow the instructions for use to a T. So number 6, you want to make sure that you're not handling like the instruments that are already been sterilized with your hand, because this can definitely compromise sterility. You want to make sure like you're not doing that. Number 7, do not neglect your PPE and infection control. You want to make sure if you are in decon that you have your PPE on, which is donning. You want to make sure that you're doing it correctly, doffing, taking it off. You want to make sure you have all those things. You want to make sure you have your gloves, if you have to wear the booties, you need to wear the booties, your mask, your face shield, everything. Because you guys, when we sterilize instruments, we never know what the patient have. Like, they can have HIV, they can have syphilis, they can have all these things. So you want to make sure that you're keeping yourself safe and also other people. Number 8, you want to make sure that you don't fail to communicate. And when I say that, that means, like, if you see something that's broken, you have an instrument that's broken and that you need to tell, like, your supervisor or your manager, you need to let them know. And I also wrote, like, instruments that's missing parts or malfunctions. Because guess what? If it's malfunctioning downstairs, when they go upstairs and they have to use it in a surgery, it can be very detrimental. Like, so say if, like, you cutting, like, I don't know, let's just say a vein, which you probably won't do, but say you, like, cut a vein or a nerve and the scissors malfunction and it cut too much, that can be very detrimental in the surgery. And the 9th thing is disregard documentation. So, like, in the sterile processing field, you do a lot of documentation. And, like, I think we have to keep our stuff for, like, 3 years. So, like, if Joint Commission or something comes in and they look over our paperwork. So, you just want to make sure that you're doing your best and keeping track of the logs and everything. So, that's something, like, you don't want to do. You don't want to disregard the documentation, say, oh, I'm not filling that out, I'm not doing it. You don't want to be that person. Number 10, you don't want to use expired or damaged items. So when I say expired items, so say if, like, the integrators that we use, they expired on a certain day and you still using them, that is going to be an error as well, because it can be just passing everything, and just because it's old, it's not reading correctly. Or, like, your biological, you know, they're expired and you still using them. We just want to make sure that we're not doing that. And y'all, this is the last one. This is the most important. You want to make sure that you're not being complacent. Because guess what? This field is constantly changing, constantly evolving. And you're going to learn some things that's going to actually make a difference. So don't just be complacent with, oh, I got my little certification, I'm not going to try to continue my education or learn anything. It's always room for improvement. It's always room for learning things. So that is the most important. Just don't be complacent and, like, get stuck in your ways and you don't want to change and you don't want, you know, because things is going to change. Things is always changing. So just learning to be adaptable and to continue your education in sterile processing. But y'all, that is it for my video. So thank you guys for staying along with me. If you haven't already, please go ahead to subscribe to my channel and hit that notification bell so you can be alerted the next time I upload a video. But as always, be blessed, be kind, peace out. Breathe the Diva is signing out.